Hello and welcome. Today we're going to be talking about sexual difficulties and solutions. To begin this one, I always struggle where to even begin. Honestly, when I was sitting here questioning where do I even start? Do I follow the PowerPoint? Do I give some big monologue? How do we begin it? Again, as we go with all lectures, I just revert back to this nice biopsychosocial approach, compounded with some history and some philosophy and all the other sciences, because we're going to need them all for this discussion. But again, if we're looking at sexual difficulties and solutions, okay, where do we start with the sexual difficulties? How do we define it? How do we diagnose it? And again, this opens up Pandora's box in my brain of when it comes to psychological disorders of any kind, we have to realize that culture plays a huge weight in that. Okay. How we decide what is abnormal and what is normal behavior is highly influenced by cultural expectations. For example, we can look at the increase in prescription of ADHD medicine. Now, do all of these kids have ADHD, or do some of them just struggle to sit, still in a school environment where they're expected not to run and climb trees for 8 hours a day and work on math programs? And so again, as a psychologist, you have to weed through, other variables that could be contributing to these diagnoses. And the same thing goes for sexual disorders. When we go to label something as a sexual disorder, we always have to keep the cultural context in mind, because it's through our culture, the language, how we structure the way we think about our behavior and what's acceptable and what's not, and what's a problem is what's not. Again, all this is influenced by culture. But we have to look at some of the scientific facts also. So again, we're going to revert to biology to look at physiological processes going on. We're going to have to look at psychology to think about how does the culture structure the way people think. And then on an individual level, how are people thinking? And then how are emotions and motivations and relationship types and closeness you're experiencing with another person? How are these all playing a role? And then we have to think about the social context. It's like your assignment this week gets into this idea of things that are being labeled as psychological disorder or a psychosexual disorder in modern times historically might not have been seen as that way, such as like premature orgasm. And you guys have an assignment on that that gets into that, and maybe I'll introduce that a little bit later when we get there. But so again, for this lecture, we're going to always take this nice biopsychosocial approach. But again, I put in this open question to, kind of introduce this lecture as what are normal levels of sexual activity and sexual cognition and sexual arousal? How much should we expect? So again, here you can see that how we go to diagnose things, we have to clearly operationalize what we are talking about. Your book starts to introduce that. Like when it starts looking at some of the specific types of disorders, it gets into the DSM-5, and it looks at how, a person has to meet this specific criteria over this specific time frame in order to be considered for this type of disorder. And your book says something like it has to happen 75% to 100% of the time over, a period of how much time and so much sexual frequency. And me, that's a little bit too specific for me, because again, how we go to label things, even if it's not a psychological disorder necessarily that we're labeling for someone, it's still something that they might be experiencing as a problem. And so again, we have to kind of walk that line between, is it just a problem in someone's life or is it a genuine disorder? And so we might approach it differently depending upon things like that. As you guys learn in psychology, some things you have to have medicine for. Other things you have to have, behavioral therapy for. And then other things, a little bit of blend of medicine and behavioral therapy can, fix the problem. And a lot of that happens with like erectile dysfunction. How much of erectile dysfunction is psychological in nature, and how much of erectile dysfunction is actually a physical problem that can be helped with medicine? And so again, we have to ask, what are the normal levels of sexual behavior, and at what point do we label it as a problem? So when we go to look at the origins of sexual difficulties, of course, the easiest place to start, or maybe the most complex and hard place to start, but maybe a good first place to start, if I can reword that several times, is in biology, looking at physiological problems, because this is relevant. There is a specific percentage of the population that may experience certain physical conditions. Plus, these physical conditions can be compounded by problems of aging or health or any of these other factors. We need to be looking at relationship factors. Again, we've talked about how through sexual or interaction, you experience all these neurotransmitters that are making you feel all kinds of feelings. But what if you're not feeling close to someone? Are you getting the same types of neurotransmitter and arousal responses? So again, how much of sexual activity is based upon actually feeling close to someone, being aroused by that person, being attracted to that person, actually just liking them? And a couple chapters ago, we looked at things like love, and is love associated with sexual satisfaction? And it is, but again, what is love but just neurotransmitters spitting out oxytocin and other things like dopamine to make you, and endorphins, and to make you feel good, right? So again, if you have a positive relationship, does that increase your sexuality? And if you have a positive relationship, does it increase your frequency of having sexual relations? And so again, it's this whole process of being in a good relationship, frequency of sexual interactions, being in good health, having a good emotional state, having a positive attitude towards sexuality, being able to communicate. I mean, all of these things come into this chapter. I could be here all day getting into that. All of these little things, I'll wrap it up a little bit with, just hinting at where we could go as a direction with therapy or how we can help people and things along those lines. But again, those are always the suggestions. Communicate, talk, try stuff, get over your shyness, get over your embarrassment. It sounds easier than it says. But again, you know, at what point do you have to be like, the heck with it, let's just do this, right? And that's again suggested by sex therapists. Sometimes you just have to work your way through it and go try on some shoes, walk around in the shoes for a while, and maybe after a while you find that you like the shoes, even if at first you were like, they're too stiff and I don't like them. Then we also have to look at cultural influences, because again, we've talked so much in this class about how culture structures our sexuality, not only our sexual behaviors, but also it structures how we should think and approach sex. Think about some cultures that are more open with the naked body, like in France, whereas in America, the naked body is highly censored and regulated by the government and law and age and other social norms. And even in modern times where we can maybe expose more than we used to, still some modesty, you see that as, a little bit more of American culture than maybe other places. And then there's cases of other countries that are very modest. And so looking at America, we seem like these super liberal people walking around in our short shorts, whereas other cultures, they might believe that showing of skin in itself is bad and hinting at femininity is bad and anything that suggests sexuality is bad. And so we have to look at cultural influences. And your book goes, a little bit into the history of all of this too, because historically, what were our cultural attitudes about sex? Was sex seen as this love, fun type of thing, or was it seen more as reproduction? Your assignment this week gets into how patriarchy historically structured sexual interaction in marriages, and that we didn't necessarily get to choose who we were with, or who we were married to, and then who we were allowed to have sex with was highly regulated by our parents and the community, and this idea of arranged marriages. So we have this whole epoch in our human history. Other times in human history, we've been very poly, and so it's mixed. But again, culture structures our sexual attitudes. When it comes to heterosexuality, homosexuality, bisexuality, same thing. If you live in a heteronormative culture, how does that structure your attitudes about sex? And if you deviate from a heteronormative cultural way of life, do you experience shame and guilt and then pressure to conform? And so if you look at things like minority stress theory and sexuality and how that cultural norms influence your psychological appreciation or feelings about what type of behaviors you're going into, again, it gets super complicated. And so individual factors we can think about, this is like definitely the realm, sociology, you think, and anthropology, culture, structure, biology, you got all these physiological conditions. But between all that is the psychology of it all. We are people perceiving the world, right? We perceive our experiences. We perceive the culture we live in. We internalize these ideas, right? So our initial attitudes about sexuality and how we should approach it and things along those lines are highly influenced by the culture we live in. And then we as people observe and reflect and think for ourselves about our own behaviors and what we find acceptable. And sometimes we go after that, and sometimes we don't, because we decide that our fantasy doesn't meet the expectations of reality, for example. But again, how we feel about sex is highly individualized. And again, but how we feel about sex is influenced by things like who we're in a relationship with, who we're having sex with, our past sexual experiences. Have we experienced any trauma or abuse in our life? Things along those lines can make it very complicated. So yeah, we have sexual abuse and trauma in here, which is, we'll talk about a little bit later, but how does that affect your attitude towards sexuality? How does that affect your openness, and how you feel about it? How does it feel about you wanting to be touched? I mean, and again, that's the whole other side of psychology and sexuality that the book doesn't like go deep into so much. But again, if you guys are going out there in the world as psychologists or nurses or anybody in these types of fields, you're going to see that. You're going to have to deal with the reality of what it's like being human and what it's like being a female or a male experiencing sexual abuse and trauma. And it's an incredibly sad, dark, depressing thing. But again, how does that not only just psychologically affect us in general, but specifically, how does that affect our attitude towards sexuality and our own personal sexuality? Things to think about. Other factors like physical health play into sexual dysfunctions, our overall emotional health. Where are you at? These things have a huge role. Side effects from medication can affect sexual dysfunctions, as disabilities can be associated with it, again, because biopsychosocial approach, right? What's going on physically, and then how does your physical situation influence, your relationship situation and things along those lines. And so again, it can be very, very complex. In general, though, regarding sexual difficulties, if we start, the book kind of opens up with just talking about our relationships, and that it says half of males and females suffer from pleasure in sexual relationships. So again, the idea that we all are having these wonderful adult sexual lives, the bubble can be burst a little bit, because at times in our life, maybe not everything's perfect, and maybe we should just accept that. But again, the idea of sexual satisfaction is completely subjective. It is that our perception of our sex life and how it is, and does it meet our expectations, or do you have that cognitive dissonance, the disparity between your realities and your expectations, right? But again, why do people suffer from not having pleasure from sexual relationships? Your book gets deep into it. I see a common theme throughout the book is that the idea of female sexuality versus male sexuality. And if you look at it from a historical context, and again, your assignment this week looks at how a patriarchal society that really only thinks about the needs of men historically didn't think about female orgasm. It was kind of secondary. Then you can think about other things like, what if we live in a prude culture and we're uncomfortable talking about sexuality in our bodies, and we don't really know how it works very well. And so again, your book throughout this chapter talks about things like self-exploration or masturbation or getting with a partner and just trying things out, and learning together how that works. But because if we live in a society where communicating about sex is shameful, that could be a problem with partners. And so if the partners aren't communicating and they're not experiencing sexual pleasure, does that lead to things like breaking up and divorce? But again, some couples, maybe orgasms are just not the whole biggest part of their relationship, that, even though they might not be having the greatest sex or wowing orgasms, it doesn't mean they're not happy and they're not enjoying it. So again, your book addresses that a little bit too. And then again, when you're looking at things like mutual pleasure, again, I introduced the history because, it just kind of ebbs and flows throughout human history. Like you have some cultures that really push, like, let's learn about sexuality and positions and trying things out and being open about that. And other cultures are just the exact opposite. Like, you're not allowed to talk about it. It's absolutely taboo. And so, again, the culture you live in structures your attitudes towards sex, which then structures the way you communicate about sex and approach having a healthy and positive sexual relationship, and yada, yada, yada. It just goes on for days. So hopefully you can see that everything I'm saying today, you can just go off in a whole field of study, right? Looking at the physical problems of sexual dysfunctions. All right. Then you can get into the psychological issues associated with sexual dysfunctions. Then we can get into all this cultural stuff and then put it all together into one big Pandora's box. Because what if you live in a culture that's repressive towards sexuality and you're not experiencing sexual pleasure, but you hesitate to actually speak out about it or seek that out for yourself? And then because you're not using those parts, do you tend to lose those parts? And again, a lot of sexuality is that. It is kind of the use it or lose it. That's why when your doctor, if you go in to talk to your doctor about things like sexual dysfunctions, of course, these are going to be the common questions. How often are you having sex? It's like a muscle, right? You have to use it. There's a reason we need cardio exercises because we need to keep our heart strong. Okay, it's like the same kind of thing, right? But when it comes to sexual dysfunctions, the book reports some pretty high numbers of 45% of females and 25% of males are suffering from some sort of what we could diagnose as psychological or physical sexual dysfunctions. However, when we consider whether or not somebody's having orgasms and erectile dysfunctions, that can increase these numbers up to 25% on each end, meaning about 70% of women and 50% of men experience some type of sexual dysfunction in their lifetime. But again, how we label these dysfunctions is what's really, very important, which is why I opened this up. So your book talks about some specific sexual difficulties such as sexual addiction. And again, sexual addiction in itself, how do we label that? How do we diagnose it? How do we operationalize it? So again, it's us as a culture that would dictate what's too much sex or what's not enough sex. But again, a good approach to this is it causing a dysfunction in that person's life? Is it causing stress, anxiety? These are good approaches, Are they having some kind of psychological distress as a result of some behavior or ways of thinking that they're engaging in? Then you have words that I will struggle to say. I'm so sorry. I should have hit the Google thing really quick, but dyspareunia, that's not right. Dyspareunia, dyspareunia, can't say it still. I needed to Google it. I needed to hear it, and I don't have it. And my Latin is not up to date. But the book starts talking about some of the female problems that might occur. This is one of them, and this is pain during intercourse or in the pelvic or coital pain. You have genitopelvic pain or penetration disorder that, again, having the inserting of the penis in, through the labia and, into the vagina causes, pain. You have vaginismus, which is involuntary contractions that also cause pain, and vestibulodynia. I had to, when I was typing that out, I had to vestibulodynia. I had to break it up. This is pain at the entrance of vagina. And this can absolutely happen. I should have put the statistics down. I think it was about 5%. But again, your book gets into how do you deal with these types of problems, right? So if you're having these types of pain, how can we help these problems? And so your book opens up talking about things like lubrication and stimulus and foreplay and creating arousal so that this pain isn't, a problem. And then it gets deep into the physiological processes of not physically creating enough lubrication. And so what happens if you can find some way to lubricate that, whether it's through saliva or some kind of an external product, for example. And these things can reduce pain. So a lot of people might avoid sex because they might have had this, but again, it can just simply because they were going at it in the wrong approach. Maybe they don't know that sometimes you need lubrication. And so by not having this knowledge and not prepping the area, which is a terrible way to say it, but again, as a professor, what I mean, I don't, what am I going to do? So use other words. I don't know. I'm recording this. It's for YouTube. Again, when I open your book, it's very troubling. Like I've opened that your book in some public places and I'm like, I don't, this is like a textbook. Can I even be opening this book? But again, why are we, is it too taboo to talk about in college? You're talking about we need to understand people and you don't want to like delve into sexual relationships and sexuality. I mean, how are you going to understand people if you don't understand the thing that most people claim is the most important thing to them in their lives, even though they spend more time doing their taxes statistically? But maybe that's why you see the rise of sexual dysfunctions, not enough time on sex, too much time on the taxes. But again, this could simply be just lack of knowledge. If people don't know how their body works, they're uncomfortable with it, they don't know how to talk to their body, their partners about it, you know. And again, I understand I have kids. Like, do I need to go teach my son how to pleasure a female if he's interested in women? And as a parent, you have to think about that because what's the downside of not teaching him? Then him having a person he's with that's not sexually satisfied, leading to them having an unhappy relationship, and then me getting all close to the person he's with, them breaking up, and then me being all sad. You know how it goes as a parent. But again, that's the things we should talk about. I don't want to talk about my own personal experiences, but you can look at, if you did qualitative research on this, you would find that most people don't understand their bodies. Your book states that women, not really until their 40s, that they really hit that point where they know how to create orgasms. And it talks about how girls in their young 20s might just be shy or insecure. They might not know their bodies very well. They might be embarrassed to talk about it. And so as a result, they're not experiencing the orgasms that they could have until they get the wisdom that came a little bit later through experience. And so your book gets deep into that. Next, you have desire phase and excitement phase difficulties. And your book breaks this down into female sexual interest and arousal disorder. And again, we have to look at this first or second or third. I don't know. It just depends on how a doctor would approach it. But again, are there physical problems that are actually going on? Is there some way that the stimuli is not occurring? What might be occurring there? So we can talk about that first. Second, though, your book talks about all the psychological diagnoses for this. And this involves like not thinking about sex, not experiencing arousal, things along those lines. And it has 6 criteria that you have to meet 3 of. But again, how much of female interest, sexual arousal disorder is genetic in nature? And how much of this is learned behavior, right? And then how much of this is structured by the society that they live in? And so again, physically, what's happening? Is there like levels of sexuality that ranges between people? Absolutely. And so there are some people that are on the low end of this. Maybe they lack testosterone or estrogen or some chemistry, for example, right? But this could also be because maybe their interactions in the social context haven't led to sexual experiences, or maybe they haven't led to positive sexual experiences, and all of this is just causing that sexual desire to decrease. And so it's very complex. It could be culturally structured in nature. Maybe they live in a culture where women's pleasure and sexuality isn't upheld or taught. And so as a result of not experiencing positive sexual interactions, this could be happening. So again, it's very complex. It breaks it into male and female. When I was first talking about this when I was reading through it and preparing the thing, I kept asking, well, why do we break it into male and female? But then I was like, you know what? There's biological differences, even though it doesn't mean that like males and females are intersex are actually really different at all, because we're not. But still, there are some biological processes that are a little bit different. The chemistry is a little bit different, looking at testosterone and estrogen. The experiences in the social context can be different because we socially construct gender categories and then we expect people to play out those roles. And so, but again, the same kind of thing happens for men. It's, lack of desire, not thinking about it, lack of arousal, not experiencing erections. And then this is also during sexual or, situations that are sexual in nature. They're not experiencing erections. They're not experiencing arousal. Okay. Then we have erectile disorder, which is a blend of physical and psychological problems. So again, we've come up with medicines. We have some surgical procedures to deal with this, but how much of erectile disorder could just be psychological in nature, not using it enough? And then here your book talks about looking at like, okay, How does it work with masturbation versus being with a partner? Does that play out? And same thing with female sexual interest and arousal disorder. How does it go when they masturbate versus when they're with another partner, right? And are there disparities between the two? And so when we get into orgasm, that's a big part with that too. But same thing with erectile disorder. Then you have desire discrepancy, which your book talks about, and that's when basically you and your partner are not in sync, and so the lack of sync is causing anxiety and distress. And then you have persistent genital arousal disorder, which is even if you're not sexually aroused, you are finding yourself, you're physically experiencing the arousal, and that's creating discomfort. Your book also talks about orgasm phase difficulties, such as female orgasmic disorder. But again, same thing with female orgasmic disorder. Your book goes deep into this, getting into the biological things that could be associated with it, right? Is it a physical problem? Is there just not exposure to the clitoris, or people don't know how to stimulate it correctly? Okay. Like your book gets deep into vaginal, sorry, that's my cat. The book gets deep into vaginal orgasms versus clitoral orgasms, and it starts delving into there's a disparity there, and that many women struggle to experience vaginal, orgasms, but they can have clitoral orgasms. But again, that could be simply just not knowing how to work the parts. And so through learning, you can find that maybe there's a way to crack into that. And a couple of chapters ago, we talked about how stimuli differs on the outer parts versus the inner parts. Like it talked about how the clitoral hood is very sensitive, and so a lot of pressure there can be like too much, or even painful. But then when you go inside to the cervix, the vaginal orgasms, there it said that it's a different type of stimuli that creates orgasms, and that you need more pressure because there's not as many nerve endings. And so to stimulate those types of nerve endings, you need a different type of pressure. And so again, it's incredibly complex why someone doesn't have an orgasm, but it could just also be things like love and closeness and connection, or being caught up in the moment, or letting yourself have that orgasm, or learning which motions feel good or stimuli feels good, and learning to explore and having fun with that. And so it's complex. Male orgasmic disorder is far less than female orgasmic disorder, but the same thing. What's going on in the moment of orgasm? Is it just a problem with the actual tubing and maybe, things along those lines? Is it lack of erections, not leading to orgasms, whatever it might be? And then also premature ejaculation. But again, premature ejaculation, your book talks about how to avoid it. And it has like your suggestions, like basically think about baseball. But again, premature ejaculation is something that, like, over time or through experience, is something that you would have to learn to control, right? And so it talks about most men in their early sexual experiences, that's just perfectly natural. But how do you get to the point where you can control that kind of thing and, use it like a Jedi force, basically, and go all Zen or whatever it is, so you can kind of control that? And your book has several suggestions on that. And then it says, even if you are having premature orgasms, that doesn't mean it has to, ruin the party, for lack of better words. It says just, if you have that first orgasm, wait till the next erection comes and then hop back on the horse. So again, we have to talk about that as cultural in nature, as maybe men are embarrassed or they're insecure, and at first they don't know how to control it. And then they're shy to talk to their partner about the fact that they don't know how to control it. And then that ends up causing problems in the relationship, which leads down the line of less sexual satisfaction and yada, yada, yada. And then also the idea of faking orgasms, because we want our partners to feel like they satisfied us. But at the same time, what if we didn't experience it? But again, how do you get to the point where you don't have to fake orgasms, where you can actually just get to the point of having orgasms? Again, we can address the physiological problems. We can look at what's going on in people's heads, their feelings, their attitudes towards sexuality, and then their experiences in the social context, and having positive interactions with the person they're with, having good positive communication. So again, a lot of these sexual dysfunctions can be improved just by communicating and trying and experimenting and learning and using data and gathering information about what works and what doesn't. And if it's something more deeper in nature, where we need some psychological therapy to help us through it, jump on board. Sometimes we need medicine to help us through it, but just because we might be struggling with these things in our life doesn't mean that it's the end of it. So how do we approach, enhancing someone's sex life or overcoming some of the sexual dysfunctions? And your book throughout the books talked about things like self-awareness and exploring and being aware of your sexual self and who you are as a person. Again, looking at not just your sexual identity, but also like, just the idea of being a sexual human and what that feels like, right? It talks about communication with your partner and with yourself. It looks at sensate focus, again, looking and stimulating different parts of the body to find out what feels good, trying things out, experimenting, using self-stimulation to learn. I mean, just what can masturbation do for you? Can it teach you about your body and what works and what doesn't? Learning with a partner, being able to communicate with your partner, be able to try out stuff and be like, hey, let's try this. Does this work? Do you want to like this? I mean, it sounds silly to talk about in a lecture, but if you're a sex therapist, of course, you can discuss that. And then lasting longer, that can be important. Not to say that like women can't have quick orgasms, but I mean, if you were to look at premature orgasms, men versus women, I think, the statistics would lean more toward men. So is the pressure on men to learn to control orgasms to ensure the female has an orgasm also? And then, but then how do you approach that, right? Because like, well, the female has an orgasm, and the male has an orgasm after that, but does the male have to make the female orgasm twice so that they can both orgasm at the same time? Or, how does all everything work? But again, this is stuff you talk about with your partner. You work that stuff out. How can you both get what you want and leave the situation feeling good? You could apply a sociological theory like exchange theory here, right? Like, are you both in this relationship getting what you want? Are you giving and taking and getting what you want? Okay. Before we get into that, when it comes to the idea of therapy, though, again, sexuality in general is complex. You have the therapy of sex abuse and trauma. You have child abuse. You have things that can affect your attitudes towards sexuality. Then you have sex therapy in general. I remember the first person that I talked to about that was going into that field. I was so nervous because I was like, wow, you can talk about that out loud, but this is the thing that it matters to people. It affects their relationships. It affects their lives. And of course, what's the goal of psychologists but to help the well-being of people? Just to wrap this up, your book also talks about sexually transmitted diseases. I am totally going to refer to your book. Please, you could, all the pictures are in there that you would normally see in a pamphlet in a doctor's office. Even myself was like, oh, wow, I'm not sure if I totally want to look at this. But of course, for the sake of learning, you have to work your way through it. But your book just, for this part of the book, just gets deep into the physiological problems associated with sexual diseases. So just to introduce it really quick, your book gets into the types of bacterial infections, viral infections, common vaginal infections, ectoparasitic infections, HIV, and preventing other sexually transmitted diseases. I will leave it to you guys to go deep into all the different types of gonorrhea and herpes and all of those things. You know about all of this. You've heard this throughout your high school. I don't think you need me ranting. I've already talked so long. But all right, I'm gonna leave that one to y'all and just wish you a great day. Cool. All right. See y'all on the flip side.